Hello, my name is Maria Perez, and I am happy to share with you all my personal philosophy of nursing and healthcare. Nursing to me is a calling. It is to provide patients with compassionate yet evidence based care, to look past their diagnoses and acknowledge the many components that make up an individual, to empower them with knowledge about their disease process and promote preventative care. We take care of patients at their most vulnerable and many times at in their worst day of their lives. A term found in the Nursing Code of Ethics that resonates with me is that of non maleficence, or best defined as to do no harm. Ahimsa is one of the ethical standards in yoga that are mentioned in the yamas and niyamas. Ahimsa and non maleficence are actually one and the same, and upholding this principle is especially important to me. A group of incredible critical care nurses are who inspired me to become a nurse 17 years ago. The combination of their medical knowledge and the compassionate care that they provided to critically ill patients was inspiring. It was then that I decided I wanted to learn what they learned. I wanted to also be a critical care nurse. I wanted to not just have that title, but provide compassionate care to patients in the critical care setting. The ICU that I grew up in was unique in the sense that despite the 13 beds that we had available, so it was a pretty small unit, the population of patients that we served were a very good mix. We had neurosurgical, critical care, cardiothoracic, cardiac, medical, and surgical critical care that at the time we were able to offer to our community in Yakima County. Nurses play many roles in the care of a patient. It is not just the patient that one takes care of, but the family as well. Providing compassionate care is important to me, and giving their families a sense of ease that their loved one will be taken care of. Values that are important to me in nursing are many. There is always something new to learn, and trying to keep up with new or updated knowledge has always been important to me as well. The presence one brings into the room can also make a difference. I believe that patients can sense when one is rushed, or even when one is being dismissive to their concerns. Making them feel heard and valued despite their walk of life are values that I bring into my work as a nurse. The ethical standards that we are held up to in nursing are there for a reason. Upholding those values in my nursing career have shaped how I practice nursing. Although for the last 7 years, the setting has changed from critical care to that of emergency medicine, those concepts still apply. Most recently, I have also started working as a clinical nurse educator for one of the local nursing programs in my area. In fact, the same nursing program in which I went through to get my associates in nursing. And I have found that playing that very small role in nursing students' education has been a great refresher, and it's been really nice to see them grow and evolve as students, as student nurses. Thank you for listening to my philosophy of nursing and healthcare. Bye now. Take care.